We are back on Morning Line. Thanks for joining us. Dr. Katrina Green's with us, emergency physician practicing in both the Nashville area and down in Lawrence County. I appreciate her joining us. We've got some calls that we'll get to that waited through the break, and we'll go next to Charlie. Charlie, good morning. Hi, Charlie.
Hey, good morning, Nick. How you doing this morning?
Good. What's on your mind?
I got two things. One is if you're fully vaccinated, like I am, I got vaccinated when I was in Florida. I took the Johnson & Johnson, and I've been around people that's been vaccinated that took the Pfizer. Do I still need to wear a mask even though the second dose, even though they're looking at having a booster shot come out? Okay. And my comment is this. Why don't the politicians just leave us alone and let the doctors do their job and treat the people that need to be treated and try to get them better? And Doc, I just want to say you're doing one heck of a job. We love you guys. Keep up the good work. You are our angels.
Thank you for your call, Charlie. What about his question about, if you're fully vaccinated and you know you're around other people that are fully vaccinated, is a mask still something that you would wear?
I would, and I wear my mask myself when I go out into the public, when I go grocery shopping, visit the bookstore, go to a restaurant where I'm going to be briefly indoors. I try to only eat on outdoor patios at this point. I don't feel comfortable eating inside a restaurant just yet. And the reason why I do that is because I know how much more contagious the Delta variant is. It's about 2 times more infectious than the prior strains of the virus. And that's why we're seeing the breakthrough infections, because it's just there's so many more virus particles that an infected person with Delta is breathing into the air. And even when you're vaccinated, it's not foolproof. When we get the flu vaccine, that doesn't mean you're not going to get the flu. It just means you won't get that sick from the flu. And that's what the vaccine is designed to do. It's not going to prevent every infection. It's going to prevent you from getting severely ill and needing to come visit me in the hospital when you get infected. And that's the main thing, the important thing. And that's why we've seen in places where they have a higher vaccination rate that the pandemic is starting to slow down in those areas. So until we get to the point where more people are vaccinated, I think it's still very important, Charlie, that you continue to wear your mask when you're around other people, because you don't know who might be breathing this virus into the air around you. And also, because you're vaccinated, you may not have a lot of symptoms. My husband's a great example of this. He only has a stuffy nose, a mild headache, and he's a little bit tired, which we could have easily chalked up to just allergies that everyone experiences here in Nashville at various points in the year. And we could have been like, oh, you just have allergies. And he could be out breathing this virus into the air around everybody right now. But luckily we got him tested and learned that, oh, whoops, that's COVID. And so he's home keeping himself out of the circulation of the public. But not everybody is doing that. Not everybody is getting tested when they have the sniffles. And I get it. It sucks getting tested all the time. I can't even tell you how many times I've been tested for COVID at this point. Like those things in my nose, it's just like a constant thing at this point. It's uncomfortable. We all hate it, but it's something you got to do if you have symptoms.
It's gotten a lot better. Yeah, it has gotten better. Early on, I felt they were swabbing my brain, and now it seems like they can get what they need by not going quite so deep in the nasal passage.
Right. Thank goodness for that, because the first time I got a COVID swab, I just reflexively reached up and grabbed my poor nurse's hand. Like I couldn't help my reflexes just did that. But yeah, it's better now.
Well, and as you heard her just say, her husband has COVID. He's home there, and that is why she is wearing a mask right now during our Zoom interview in the home, and she's taking abundance caution here, especially as a doctor. She doesn't want to get sick because she's needed at the hospital, and she's playing it safe because her husband is there with her. That's why. Otherwise, if they were both healthy, I would imagine if he didn't have COVID and you were home right now, and you would be doing this interview without the mask had he not been sick. It's just the two of you in the house, correct?
Exactly. Well, and our cats.
Yeah, and your cats. Okay.
No,
okay, gotcha. All right, let's go next to Tom. Tom, good morning. Hi, Tom.
Hey, guys. How's it going?
Good. What's on your mind?
Well, I'm the Chihuahua Ziggy Stardust pet human.
Yeah.
I was born in Nashville in January of 1947, so I've been around. As far as Republican governors, we've got one that's a total joke. This guy went on Sean Hannity on Fox News and said children do not get sick from COVID-19. Well, here's our solution. There is a doctor that's running for governor next year. His name is Dr. Jason Martin.
All right, well, hold off there. I know where you're going. We were talking about we're not wanting to get politics involved in this thing. We don't want to make, call names or whatever. But out of your question, I want to ask you this right now with regard to children. Have you seen many children come through your emergency rooms with COVID, at least in recent weeks since schools resumed?
So it's been probably a little bit since I've had a pediatric case that I knew was positive. Right now, we're so overburdened in the emergency departments that we're not doing a lot of rapid tests on those who aren't critically ill.
Okay.
So we're doing a lot of swab and discharge, and so I never get the results of those. But I do suspect that I've had a lot of pediatric cases, those who've been exposed and have the symptoms and just look like they have COVID. But a few weeks ago, I was very concerned because I had my first 2 pediatric COVID cases that I had diagnosed. At that time, we had enough of the rapid swabs, so I tested them both in my emergency department in real time and got their tests back. And the thing that concerned me most is in that school district, they were both due to start school the next day.
Yeah.
And thank goodness their parents brought them in to get tested, because otherwise they could have easily went to school and there would have been an outbreak in both of their classrooms. And that's the concern right now with kids in school is the virus is spreading very easily amongst children. And I have a friend who works in the ICU at Vanderbilt, and she is deathly afraid of her 3-year-old catching the virus because of what she's seeing firsthand treating sick COVID patients there.
Yeah.
Our children are vulnerable to this disease. They can get severely ill, and we need to do everything we can to protect them until we can get them vaccinated.
Okay, and with regard to how busy it is in the emergency rooms, I guess a lot of it sometimes is COVID, but I'm just wondering, if someone shows up in your emergency room later today with anaphylactic shock from a bee sting, do they have to sit out there and can't get treatment and are turned away? Or how busy is it in some of these emergency rooms for folks who come in with other conditions aside from COVID, of course, which happens all the time?
Right. It does put a strain on our system when 20% of our hospital beds are filled with COVID patients. Our hospital's not used to treating that many patients that are that sick for that long. COVID patients that are admitted to the hospital tend to be admitted for a long period of time. So that kind of has a downstream effect to us in the emergency department, because when we have a COVID patient or any other patient that's sick that needs to be admitted, our hospital doesn't have the capacity.
Okay, but
So
someone with a bee sting, are they going to get treatment or not?
They will get treatment. We are very good at working around. We're the MacGyvers of the medical field in emergency medicine, and so we will never let a critically ill patient that we're aware of that we can treat sit in our waiting room. Now sometimes that does occasionally happen because there's nowhere physically to put them, and we don't have the staff. But if we can get that patient even treated in a hallway bed, get started on things, we do that. And it sucks to have to work around like this. No one wants to be treated in a hallway bed in the emergency department. And we all hate having to do that, but you got to do what you got to do. Desperate times call for measures.
Let's take a call from Lisa. Lisa, good morning. Hi, Lisa.
Yes.
Hi, Lisa. Go ahead.
Hello?
Hello.
Yeah, this is Lisa.
Yeah.
Hi, can you hear me?
Yeah, just you're a little muffled, but go ahead.
Okay. A relative of mine in Texas, it saved her life. The Ivermectin saved her life. Now, we know that what it is. Actually, I'm going to go ahead and tell you now, this virus is all over the place with me. I am actually afraid of the hospital and the health care right now because I feel like they're trying to kill us and the children. But this Ivermectin is an anti-parasite, which it is developed to kill parasites in the body and to be effective against this virus.
Well, I mean, we're not going to go any further with that. Just so you know, the virus is not a parasite, and there's no evidence of that. So, you know, Doc, there are still people that firmly believe in ivermectin, just the way they believed in some of the other drugs early on that some folks were claiming worked that didn't and actually made you worse. I don't know how you get past that. She claims she has a loved one that got better from ivermectin. I can tell you, I have a friend personally whose father died taking ivermectin instead of going after the regular treatment, and he's dead. So, well, I don't know, how do you handle that? What do you say? We don't know the situation with why her friend maybe recovered. It could have been from in spite of the ivermectin. I don't know.
Right. And there's always going to be people out there that you just can't convince. You know, we just have to follow the science in our hospitals and let that guide us as physicians and doctors at the bedside treating patients in real time. And right now, the science that I'm seeing and that we're all seeing is that ivermectin does not work against this virus. Now, right now, there is a study that's happening, a large study in England, and I'm not sure how many patients they've enrolled yet, but they are actively studying ivermectin to see if it does any good. If that study shows that it helps, I will prescribe it. But as of right now, the science we have currently does not show that it does any good. So I will not be giving that medicine to my patients.
And we know that, you know, local poison control has reported that they've had their share of calls for folks who have overdosed because what's happening is doctors aren't prescribing it because of what you just said. At this point, you can't, and you could get sued for using it because it's not approved. Folks are going to co-ops and buying the ivermectin that's for horses and taking massive doses of that and then getting sick. So, I mean, that's where it comes down right now. Look, if you don't want to get the treatment that the doctors are providing, I guess you can go to the co-op and get yourself your ivermectin. Good luck with that. Let's go next to Ray. Ray, good morning. Hi, Ray. Good morning. Good morning, Ray. What's on your mind?
Yeah, I want to thank the lady for getting on there and proving to other people that you can wear a mask and be interviewed on TV, and that wearing that mask is an honor and dignity to do it, even though you've been vaccinated. And I noticed where on the internet that Kroger's, the largest Kroger's store in the stores in the United States, is going to go back to requiring all employees, vaccinated or not, to wear a mask on the job in the store, and asked all customers who come in to please wear a mask. And I noticed the television people have not advertised that very much. But people think because they've got the shot that they can drop their mask. And the people that wear the mask, they think they don't have their shot, and they're fussing at them for wearing a mask. The mask protects us from these variances that are coming out new on these viruses. That one virus is not the only one out there. There's probably 15 or 20 viruses that are developing over the shots.
Yeah, I hear you on that. The masks, and you know, there are, Doctor, as we go to the break, more businesses out there, you know, that are mandating vaccines for their employees. And it's interesting, the ones who were against a vaccine, maybe fearing that it's dangerous or untested or something along those lines, even though they're willing to take these unproven things like ivermectin, are, you know, faced with maybe not being able to continue to earn money. Yeah, all of a sudden, how strong is their conviction? They're getting the vaccine. And other folks on here that, you know, some people are saying, well, Nick, you're acting like a doctor here. No, the doctor's there. I'm trying to deal with some of the facts. But folks online talking about how ivermectin was initially approved for human use. Yes, but not for COVID, for parasitics in certain cases, river blindness, things like that. Not COVID. Get it straight. We'll take a break. We'll be back. Our final segment with our guest right after this.